Good evening everyone, Sapna this side with you from Fakir University Hospital for today's session of Ask FUH as part of our Surgical Institute. Today we have with us Dr. Giovanni Ojeda. He is a renowned specialist otolaryngologist, facial and plastic reconstructive surgeon. Dr. Ojeda has a global experience of more than 21 years of working in Colombia, USA as well as now in UAE. So welcome Dr. Ojeda.
Thank you, Sana. Thanks for having me.
Thank you. And Doctor, we are talking here as part of the Surgical Institute at Fakir University Hospital. You being a renowned ear, nose and throat consultant, today why not we discuss about minimal invasive surgeries in ENT.
Great.
And we will have a lot of questions related to this for our audiences. And so let's begin with this.
Sure.
My first question will be, Doctor, what is mean by when it comes to minimally invasive surgeries in ENT? What does it mean for a common person or a common patient?
Okay, well, minimally invasive surgery in ENT has been a part of our specialty since many years before, because as an ENT we are used to practice surgeries through small ducts, cavities, through small openings in our body, and we are used to use endoscope, lenses, microscopes, too many powered instruments to perform a surgery. So minimally invasive surgery in ENT are all of those procedures that we perform through normal orifices in our body with the help of many technological resources in order to reach distant organs and lesions and to improve in that way the health status of the patient. In that way we could use through the nose, lenses, endoscopes, and fiber optic tiny cameras, and we could deal problems not only in the nose but also in the paranasal sinuses, in the orbits, in the lacrimal ducts, even in the brain. And through the external ear, we could deal problems related with the tympanic membrane, the middle ear, the inner ear, and also the brain, the medial cranial vein. And finally, through the mouth, we could deal problems in the pharynx, in the voice box, and all the glands in the head and neck area.
Okay, all the glands in head and neck area as well. Okay. Doctor, are there any main differences or advantages of using minimal invasive surgeries in ENT?
Yes, certainly. The main differences are that with minimally invasive surgery, we don't have the necessity to do any cut in your skin, any incision. So we avoid this one. This is the main advantages. But also we could do a more precise anatomical treatment of the lesion in the organ, specific organ. And finally, we could preserve a lot of healthy tissue. In that way, these differences allow us to understand the main advantages. So there is a scarless incision, scarless procedure, which is something very important in the area of head and neck. And also, if the patient we preserve a more healthy tissue, will allow us a faster recovery, less medication. And if we could do a more precise and anatomical performance surgery, the patient get a more control of the problem finally.
Okay. So I understand is less interventions, less
invasive.
Less invasive.
That's right.
It's less scars, less tissue damage, less pain, faster recovery.
Absolutely.
And
all of them.
Patients are back to their normal life.
Yes, certainly.
Less time.
That's right. Most of the patients get back at the end of the first week, almost with any kind of minimally invasive procedure in ENT. This is one of the main advantages.
Doctor, how many days, if may I ask you, a patient will require a hospital stay or?
Most of our patients are day cases, so they don't need to stay just one night here in the hospital with this kind of procedure.
Okay.
They are discharged a couple of hours when they completely awake and when they have taken kind of food or liquid. In that way, they are again at home getting the best healing environment for them.
Okay, so doctor, it's minimum, it's a same day discharge. Patient, they come in the morning and they leave.
That's
and
right.
Maximum is 1 day, not more than that.
No
and
more.
Patient can go back to their normal routine within a week's time.
At the end of the first week, most of the time.
At the end of the first week. It's very fast, it makes
It's
sense.
faster recovery.
Yes. So, Doctor, minimal invasive surgery in ENT allows faster recovery. This is what you said compared to other techniques. How, Doctor?
Well, certainly, because as I told you before, the more healthy tissue you preserve in an approach of making a exact surgery, the less damage and the less requirements for your body to repair these zones that, despite that doesn't have any problem, certainly there has been damage or injury in any way just by the approach. So minimally invasive surgery allows to save as much healthy tissue as possible.
Okay, so as much healthy tissue as possible. Doctor, this is my last question to you. Minimal invasive surgeries, can it be done everywhere, or does it require any kind of special training to perform it?
Well, it's true that any specialist could be trained in this type of surgery if he's really interested. He could visit any place in the world where this type of training will be offered. But the cutting edge technology that is required, the cost thereof that is required, and the special learning curve that every surgeon should reach in order to perform adequately this surgery, allow that a center like this one, in fact, University Hospital, could offer patients from every different part of the world the best and the smartest solution in surgery. So this is my invitation, Sabna, to all of the viewers to visit us and to allow we offer the best and the smartest solution in this type of environment. Plenty of high-tech academy and compassion.
Okay, that's thank you, Doctor. And is there any other recommendation do you have for viewers?
Well, most of the procedures in ENT could be done in different ways, but the best that you get informed about what is the easiest, not only the easiest but also the best way to recover your health, especially in this area. You should try to search about it and to get to the right spot, to the right institution. This is my best advice.
Okay, thank you so much, Dr. Ajeda.
Thanks for having me.
Thank you so much for your time for this. Signing off today with me is Dr. Ajeda from Fakir University Hospital. Thank you and see you next week.